We may have a question or two. I've talked to Terry a little bit about them. We'll probably just talk a little bit about the agricultural side of this with the meat processing and what the president did yesterday about that. And then we'll talk a little bit about, I really want to, if you don't mind, as our communities are similar, with you being from Jasper, in Jasper, a businessman representing at the state level and now the federal level, talk about all these things are relating back to Jasper, and I know all in a good way. So again, we'll start here, and actually we're getting ready to start right now.
Okay.
So thank you. All right, I think we'll get started. This will be our 5th weekly press conference. Today we have our Kosciuszko County Health Officer, Dr. Bill Remington, who will give us an update from the Health Department. County Commissioner Carrie Groninger, who will also talk about the county's efforts to as we move through hopefully the next phase of this thing. And this morning we're very thankful to have Senator Mike Braun live from Jasper, Indiana. Good morning, Senator.
Good morning.
Certainly appreciate your time. Before I get started, I really want to thank you personally for your responsiveness to our community and to all Hoosier communities, as well as your staff. They've done a marvelous job keeping us informed. I know taking some time to get on with us on this small press conference today is most appreciated, but you know, again, we really feel the love, if you will, from the federal side of government, with as much as our entire federal delegation has been very plugged into this, and your group, your staff have done a marvelous job. So thank you very much for that.
You're welcome, and I do have a great team for any constituent across the state running into any issues. Even when we get coronavirus in the rearview mirror, make sure to engage us because they do a great job. Probably the caseload that we handled the most would have been, sadly, with the Veterans Administration prior to this. There's been some improvements, but DuBois County, I think, is right at the top in terms of veterans per capita. And I was just, you know, that's a place where we ought to shine well at the federal level. And it's like many things we do there, not nearly as efficient as the government you run in your hometown and state government as well. So I aspire to get the new job in line with what I'm used to back here at home.
Right, and you're absolutely right. I know Veterans Affairs are critical in our community as well, and all those efforts are appreciated. So, well, you kind of referred to looking at the coronavirus in the rearview mirror. I'd like to think that's going to start to happen maybe this Friday when Governor Holcomb lays out his direction for the next several weeks as far as kind of easing us back in. With that in mind, could you talk a little bit about maybe the more current efforts that the federal government has recently enacted, just kind of bring us up to speed with those things that are going to help us with the healthcare industry, with our small businesses, family schools, just, you know, again, small communities like Warsaw and Jasper. How are we going to feel the positive effects of all the things the federal government has done, and again, give us kind of an update on the more recent improvements and recovery acts?
So, of course, we did actually 3 rounds, and when we first started, there was no idea how this thing was going to unfold over time. I think most of us have had the benefit of seeing what the worst case scenario looks like, and that's occurred in New Jersey, New York. 40% of the cases have been in those 2 states. You take a cluster of about 3 more states, and it's over 50%. So we now know, and I won't repeat all the guidelines, but that's going to be part of how we go into somewhat of a new normal here in the near future. But the federal government basically had to step in, and I'm one of the more fiscally conservative senators. There aren't a lot of them out there, and you got to remember, we run trillion-dollar deficits annually and seem to shrug them off. We've added $3 trillion to government spending, and I, you know, as we were doing it, wondered if it was necessary. We basically shut the economy down due to the uncertainty of the disease, and that's why I'm so anxious to see what we're doing currently, and that's a smart restart. But you can tell how deep and broad the issue is when you go through $350 billion worth of loans to small businesses. Some of the larger small businesses, and that's the problem with government, you had a 500 employee cutoff, and now many are going to have to give that money back. The smallest of the small didn't get helped out in that first serving. So everything we've done this time sets aside money for that, as well as hospitals have been on the front line of this and have to shut down all their revenue sources to get ready for the coronavirus issue. Example, Du Bois County, my home county, 43,000 people. We pay attention to the rules, got a lot of large businesses just like you folks do in your county, and they acted responsibly. We've only had 18 cases, and they've not had, I think, one into the ICU. So that, thank goodness, the governor let hospitals selectively and smartly start doing elective procedures to get some revenue going again. So I think beyond what we did, it's going to get difficult for us to replace the real economy. And you've heard discussions of certain state governments, really asking the feds to come in and help. That's a difficult issue because most of the governments do not run balanced budgets that are asking, do not have rainy day funds, and have a really high cost state government and have pensions that are in difficulty. So that is going to be a difficult thing to navigate through. A lot of conservatives and the places across the country are also worried about frivolous lawsuits that might arise as we try to get people back to work. So those will be the two areas that we're kind of wrestling with. In terms of will there be another addition to the PPP, I think it's going to depend on how well how we get this stuff out to the places that need it the most.
Right.
So it was necessary. How much more we can do after you put $3 trillion onto it in 1 year, that's going to be a difficult thing to get around. So.
Well, and that kind of brings up my next question. Looking ahead, I know yesterday the governor announced a new testing program, and I'm assuming that was funded by the CARES Act. HSSA is getting money out to do that testing, and it's a pretty significant program. They're adding 50 sites. I think they're wanting to test over 100,000 people a month, if I remember my numbers correctly. And that seems to be one of the most important elements of trying to bring this whole thing back, is that we have robust testing, and even the governor has got his study of 5,000 random Hoosiers to try and look at
right.
the undercurrent, what's underneath the level of confirmed testing. So, testing is a big element. It's the data that the governor appears to be using to reopen and to gradually do it in a smart way. That testing, and assuming, I think he said it was $17 million that testing was costing the state. I feel like we're going to have to sustain that testing until we get some kind of vaccine. And I think the vaccine is going to be what all elements of this crisis are going to be looking at to try and give us a little bit of a sigh when we finally have that vaccine. Do you feel like that this federal spending to at least address this testing issue is critical and must go on until we have that vaccine? So
that was $25 billion, along with an additional $75 billion for the healthcare system in general, was part of 3.5, what just occurred. So testing is essential. Sadly, though, I don't know that we'll be able to test quickly enough in a way that you can, with full confidence, reopen the economy. And that's going to make it a little tricky, but your point is correct. I think there'll be enough tests to make sure we have them in the places that have had a high incidence rate. Businesses, like the one in Logansport, that have to really be careful because you're going to have employees that simply aren't going to feel safe coming back.
Right.
And testing, I think, in terms of across the country, every person is something we aspire to, but realistically, we'll probably have the virus quieted down by that point. We'll be prepared with tests, of course, for a resurgence or for something like this in the future. I spoke to the CEO of Roche Laboratories, headquartered in Indy. Having talked to David Ricks, who, of course, Eli Lilly's got some testing they've gotten involved with as well. He indicated that roughly 40 pharmaceutical companies have been working at a breakneck pace to get tests done across the country. So that has been politicized in a way because everybody agrees with the idea of having tests available for the people that want it and the businesses that are going to need it to feel confident. But he indicated we've only had the genome for 3 months,
right,
and that there has not been any stone unturned to pursue testing, and he would be one of 40 companies that have been pouring the coals to it. So that's become a little bit of a political issue because we all believe that, and some, I think, slant it in a way like there's disagreement with it.
Right. So, again, looking at potentially the vaccine, have you got any updates? I know those researchers are, as you say, pouring the coals to it to try and get that done. I think clinical testing has begun. What are you hearing from your level as far as potentially how that may play out as far as a timeline?
So, between vaccines and herd immunity, and by the way, the country of Sweden has taken a different approach, which is interesting, and we'll have a comparison. Of course, they want a vaccine as well, but between vaccinations and herd immunity, you've got to get up to where about 65% of the population has either been vaccinated or had it and have immunity. So, and now we're looking at, instead of 3 to 5 times the number of reported cases, you're hearing factors of 10 to 40.
Right.
So if you take the cases we have now, that puts it up there to where it could be anywhere from 10 million, to 40 million people that have got it already. We won't know that until you do get a little testing to get the stats correct. So vaccination is probably in other countries ahead of where we are, but he indicated as well the companies that are into that component of coming up with vaccinations are working at a breakneck pace as well. But the end of the year to maybe the first quarter of next year is about the best I've heard, even if we take a vaccination from another country that has been tested and proven to actually work.
So, again, I'm probably getting too clinical here, but those folks that have had the virus, and if there are many more that you say have had the virus and have developed antibodies, is the assumption that they will be not be able to recontract the virus? I've heard that, if there's a lot of mutations in the virus, that could impact the vaccination as well as this antibody situation.
That's true. And so that's called conferring immunity due to having the antibodies. And they think that is very likely on the tests they've done with rhesus monkeys and so forth. So that's not an absolute. That's part of what we find out as we go forward. So that would make this thing a really tricky dynamic if for some reason, there wouldn't be immunity conferred with having the disease and, forming the antibodies. Then I think that would put this into a whole different dimension. Everyone I've listened to thinks that would be very, very unlikely, that there's not conferred immunity from having the disease and having antibodies in your system.
All right. Well, again, I think that's a critical part of this whole discussion, because to me that does represent, when we get to that point where there's immunity either from conferred or a vaccination, that we can start to have a little bit of sigh of relief. So thanks for the update on that. I know we've got a question from the Warsaw Times Union reporter, David Sloan. David, you want to go ahead?
Yeah. Costa County is a very ag community, and in the news this week has been food processing plants with the high rates, employees being infected and shut down. Then, Trump had the executive order yesterday. How will this all play out, locally, and kind of the effects on I mean, what will become of the meat industry, I guess, and all that's tied into that, I guess?
Right. No, it's a good question because my experience has been not only with starting a distribution and transportation company, but been heavily involved in agriculture. Had a turkey operation for 32 years. Coronavirus was a big deal in livestock and poultry because it was one that was so contagious even there that in many cases you had to shut down your operation for 6 months, sterilize it to get rid of it. So in this case, we don't know how that's going to work because poultry and meat packing lines are closer to elbow than they are probably 6-foot spacing. So that's where that ingenuity and improvising and figuring out how to do it is going to be important. President Trump, through the DPA, declared meat packing and poultry processing companies, a critical industry and wants them to stay open. That's going to be up to the kind of the ingenuity and agility of the folks that run these companies and the people that work there as to how that's going to work. So agriculture it's the second probably biggest sector of the economy in Indiana, next to manufacturing. We're the largest per capita in the country on manufacturing. Of course, auto plants have been closed down. It kind of brings up the big issue that I was concerned with, did a couple floor speeches, is because of the uncertainty of all of this and how long do you wait to kind of do a smart restart. That's on the governor's mind, I know right now, and I think he's going to tell us that over the next couple of days. In my opinion, it's county by county within any state, and it's state by state across the country. And I feel real good about the fact that that is going to be how we address the economic component, and the trick's going to be not to give an inch back to the disease for the investment we've made in shutting down the economy at this point. So meat packing and poultry processing are going to be two of the trickier places to get it done right. Nobody has a good answer as to whether that's going to work or not. Take a little risk, mitigate it, be smart about all the things we know that keeps transmission at a low level, and that's going to be the new dynamic going forward. Meat packing and poultry processing is just going to be a higher level of difficulty to get through it.
Interesting. You mentioned county by county, and that was kind of one question I'd had on my mind. And again, I think we'll see what the governor proposes Friday. I noticed the governor of Michigan, I think she had 6 or 7 regions. She had split the state up into regions, so it wasn't so much county by county, but the point was it wasn't a one-size-fits-all for the entire state. Closing down, that makes sense, but coming back, I think you suggest county by county. Any more comment on that, or does that seem to make the most sense?
Yeah, for instance, the first state that stuck its neck out would have been Georgia. And that as anxious as President Trump is, and I like the fact he put out that 3-phase plan that gives federal guidelines on what you need to look at in reopening your own states, and that's going to be the decision and prerogative of every governor. He basically did it down to tattoo parlors and bars and some other stuff, I think, and did it across the state. In my mind, it might have been a little, when I talk about mitigating risk, not doing the Atlanta metro area
right.
the same way you would have done your rural counties, and maybe taking the it was arbitrary as to who was essential and non-essential. I can tell you every downtown merchant in my hometown was tabbed non-essential. They all, from the get-go, thought they could have adhered to the spacing, curbside delivery. Of course, that got tweaked about 2.5 weeks ago on curbside for the same thing restaurants have been doing. And that's what I mean in terms of how you smartly reopen. You take the businesses and the sectors that probably got the best chance of not reigniting anything in terms of a flare-up, and Du Bois County, 18 cases. We're the regional hospital hub. never, ever got close to where that was an issue. That should be treated differently than Metro Indianapolis and surrounding counties. And I think that's probably what the governor will do.
Well, appreciate that insight, because I know that's on a lot of people's minds. Dan Spalding from Ink Free News is here with us, and I believe he has a question. Dan?
Yes, I'm curious, given the fact that the state won't start widespread testing until next week and the Logansport hotspot, are you advocating for any level of opening of Indiana next week?
So that issue of testing, like I said earlier, is going to be to where we're never going to be probably a pace with what some people think you need to have to be safe about doing it. And we all, and like I said earlier, if you talk to the people that are responsible for doing the test, they're real close to where there will be a cascade of them available that are accurate and quick to get the results. In a place like Logansport, it would be like nursing homes, in my opinion, to where the highest level of scrutiny and the available tests that you've got need to be directed there. When I mentioned Sweden earlier, they took the approach of putting an iron dome around the ones most vulnerable and let the kind of herd immunity approach run through the rest of their country. We don't know if that's going to make sense or not, but I do think that there's probably a happy medium. And the happy medium would be wherever and that's been the big flare up in Indiana. So I think there you treat it much differently than you would places that have maybe had hardly any cases. Or if you get a poultry processing plant like we do here in my home county, or the neighboring county of Davies, Purdue Farms and Far Best Foods, they probably are going to have a different level of scrutiny, and we need to make sure the tests are focused there as they become available.
All right. Another question, Dan?
Yes, please. Well, the U.S. represents about less than 5% of the population of the world. I believe 25% of the deaths have happened in the U.S. Why hasn't the U.S. done better in preparing and battling this? Or do you feel as if they've done well?
So I think you got to look at, there's so many variables that enter into that. The information that we might have been getting from some countries, I don't think would have been complete. China, the place that this originated from, I don't know that you can trust a whole lot that they give you. Many other countries that, we're a country where freedom of movement, we're the economic hub of the world. The number of people that came in and out of New York when local politicians and state government didn't think it was a big deal back then. All of that enters into how good a job we did. I think the two biggest things we did kind of mitigated was when, and it was controversial at the time, when President Trump, banned travel from China outside of Americans coming back, and did the same thing in Europe. We're not going to know these answers until we kind of dispassionately go through the results as we learn more and get more. And I think when it comes to how good a job we did, all I can tell you is, speaking to the people that are responsible for making the test, they said when you have something like this and you've had 3 months to study the disease, come up with tests, reagents were a short supply all along the way, that I think that we've done as good a job as we probably could have, given the forewarning that we had and the nature of how we live in this country.
All right, thanks. Questions, gentlemen? Okay. Senator, thank you so much for your time. Anything you want to close with? I'll give you the last word.
So I think up to this point, I think we've done things well here in Indiana. You have to rely on the healthcare experts in terms of how this disease works. We know it's got peculiarities and that so many are asymptomatic. Most everyone is mildly impacted, and it disproportionately and horrifically impacts people that have comorbidities and have a certain kind of a predisposition to it. And I really hope we do better in protecting the most vulnerable, and then take maybe an approach that is a little more, not risk-taking, I think that's a wrong way to put it, but to where you're a little more entrepreneurial in terms of how we open up the economy. My background is in economics and running a business. I was a biology major when I went to Wabash, so I've always, with the intention of wanting to be a doctor someday, so I've paid close attention to that. But you still need to listen to the experts there, and we can't backslide in anything that we do. But the more difficult part of the equation is going to be what we do from here forward than I think what we did from the point when we knew this was something to be worried about to where we are now. Now we have to do two things at once, or else we're not only going to have all the tragedy that's occurred from the disease itself, we're going to have an economic patient that's going to be, probably as sick as, relatively speaking. And I really think we can do both. Not give an inch back to the disease, pay attention to what the healthcare experts have told us, and on a rolling basis, county by county, state by state through this country, do what we've always done well, work hard, have ingenuity, and be optimistic in the process of doing it. That's going to be my approach.
Well, thank you, and I certainly, from the Warsaw community, appreciate the time you've spent coming into our community today through the marvels of technology, and tell Mayor Seitz to keep you busy down there, and anything we can do to help you, let us know.
Thank you, Mayor. Enjoyed being on with you.
All right, pleasure. Thank you, Senator. All right, let's move on. I've got a few things I wanted to talk about. We talked about the masks that are going to be a mainstay, I think, of this recovery as we move ahead. And I think we had about 350 masks that I'd mentioned last week were available at Station 2, which is out across on Center Street. Those masks went within several hours. So those masks went very quick to the public, which tells me it was probably a good way to distribute them. So we have notified those that have been providing masks for us, and they are going to continue to drop masks off as they have them. I heard there was another, I think 50 this morning, maybe dropped off yesterday. So masks are still available for pickup at the fire station at Center Street, and they are also available. We're asking those that are making masks that wish to contribute those to community folks to do so at the fire station as well. So it seems to be working very well. It's simple to do. There's a small vestibule in there that we keep clean, and the masks you can basically self-serve, if you will. I think you're all asked to probably launder those masks before you use them, not knowing who's touched them and where they've been, but for the most part it's been very successful. So we hope to continue that, and thank all of you that are volunteering and taking your time to make those masks, and those that need them. Like I said, I think that's going to be a mainstay of where we're headed for the next few months, that those be worn in public. So we'll continue to try and make those available. I was going to try and give you an update on the KEDCO Small Business Loan Fund that we announced last week. I was not able to get a hold of Alan at KEDCO, but again, I know that will be opening soon. I think Friday at the Board of Works. We will sign our agreement with KEDCO, and those funds will be ready to be applied for. Farmers Market will open as it normally does on the first Saturday in May. I've talked to the organizers. They're going to practice social distancing. There will be food, and there will be plants available, but there will be no other craft items until we get to the point where we can do that. But right now, with the stay-at-home order, I know food supplies as well as planting supplies are approved as essential. So I know the farmers market is anxious to get started. We'd ask that you come down, not in groups, maybe on your own, do your business and leave. And again, I hate to say that because the farmers market is designed as a community event, but in this day and age, and at least for the next few weeks or however long this lasts, it'll be primarily for essential shopping, if you will, and then we'd ask you wear a mask and then travel back home. There was a question a few weeks ago about virtual job fairs, and on one of the hundreds of webinars I've been on, there was information given by the Department of Workforce Development. If you go to dwd.in.gov and go to the DWD News section, there's information about virtual job fairs there. Also, Indiana Career Connection website is offering virtual job fairs as well. So there's an answer to a question I think one of you brought up a couple weeks ago. I'm not going to spend a lot of time on the reopening announcement that we anticipate the governor will make this Friday, because he's kept it pretty well under wraps. We assume there will be some movement in a loosening of the stay-at-home order. I don't know if the stay-at-home order will be rescinded, if it will be loosened, if there will be additional less restrictive provisions put in. There's just too many moving parts. I know yesterday in the governor's press conference, he talked about waiting till the very last minute to try and gain as much data as he can. And as we talked with Senator Braun a few minutes ago, will this be a county-by-county approach? Will it be a regional approach? Will it be an urban versus rural approach? Again, there's a lot of uncertainty, but I do feel like there maybe, as Senator Braun suggested, we might be starting to see a little bit of the coronavirus in our rearview mirror. But I know we got a long way to go, so I probably wouldn't say rearview mirror, maybe side mirror right now. So I do know if there is some relaxation, I know Bob Connolly talked about at the county, when they reopen, they will probably not open their building for the first week to the public. I think they're going to do some cleaning and try and protect their employees by maybe making some modifications to how they interact with the public, and we'll have to do the same thing here. But I think we need to know what the rules are before we try and address that. So it will be, I know the city will be a little bit delayed in our reaction as far as exactly when City Hall may open up. And again, I don't even want to venture that far, because I think we just wait till Friday and see where we stand with that. So with that, I'll turn it over to Dr. Bill Remington from the Kosciuszko County Health Department to get his current thoughts and updates.
Thank you, Mayor. Let me just give you the update as far as our cases. As of this morning early, we have a total of 34 cumulative cases in the county since the outbreak started. We know of 19 of those have recovered. We've had one death. There was a question of a second death there for a few days, and it was really, I think, an accounting issue as to what you do with a probable or possible COVID case. That was not a test positive confirmed death on several attempts at testing, from what I understand. So that fell out of our confirmed death category. So we remain at one confirmed death and one possible COVID-related death. Of that growth in numbers, those who've been watching our curves will note that it's gone up. So the last 7 days, we've seen 10 new cases. Now here's the interesting part. 7 of those were part of a mass testing protocol through, I believe it was 1, maybe 2 nursing homes. I don't believe either facility was in this county. But they had workers who lived in this county. So 10 new cases, 6 of those had no symptoms. That is, they were asymptomatic patients with an employer mandate to test, a nasopharyngeal test, okay, not the antibody test. So 6 of those 10 new cases had no symptoms. 4 were mildly to moderately ill. We did not see that we are aware of anyway, a single hospitalization out of those 10 new cases. So all that to say and to highlight this, that the case count will go up in this context of how to open up the economy. It's because the paradigm for testing has really changed. Couldn't get to a test when you really wanted a test for sick patients 6 weeks ago or a month ago. Testing's more available, and there are certain sectors where employers want asymptomatic employees tested. So those numbers will fold into our aggregate, and we'll have to sort that out. So watching the syndromic, you've heard me use that term before, watching the syndromic surveillance will be increasingly important as we look at the numerical growth of our cases. That is, what does this look like on the front lines? How many of these people are really ill to be hospitalized? How many of them end up on a vent? Do our frontline service lines feel swamped? Are they seeing a surge clinically of sick patients? That's the syndromic surveillance piece that we need to further develop at a county-by-county basis. And just this past Monday morning, I had an email from the Indiana State Department of Health that they and Regenstrief Institute were going to roll out some syndromic surveillance tools to place in our tool chest, we hope, on a county-by-county perspective. So stay tuned. Adding sophistication, there are ways you can gather these metrics real time using ER chief complaint data that rolls into this database that Regenstrief developed years ago. It needs to be tweaked a little bit, and we need to make sure we know how to use that tool. But that's the piece to watch as this case count goes up. If nothing else, just the bare knuckle experience with how many of these are being hospitalized, that alone will help us understand. Antibody testing remains very uncertain. A couple conversations I was in already this morning were regarding access to the antibody test. I've had just private patients calling in wanting an antibody test, and antibody testing will be part of surveillance testing across the state as part of a formal study. Again, IU, School of Public Health, ISDH, Regenstrief are doing that. Thousands of tests will be rolled out on a randomized population basis, and it will include an antibody test that they're going to collect the blood samples up front, but they're going to await vetting of the best antibody test before they run those samples, interestingly. So it tells you where the academics feel we are right now with the access to antibody testing. They don't trust it. So it needs to mature. That topic needs to mature. Not that people won't be going to get antibody tests. I will remain fairly uncertain as to how to understand what to do with that test result. We'd hope that all those positives that might be identified would truly represent a growing awareness of a herd immunity that means something in the community. My personal take, just being a clinician as well as a public health guy, is that there's been a lot of disease out there, even in this county. Fortunately, for whatever reason, we've not had a huge proportion of very ill patients. We've had some scary scenarios and one very unfortunate death, to be greatly respected. But I think it will be okay to cautiously open the economy despite a growing case count. I really do. But I think you need to be very smart about it. You need to be surgical in that interdiction, back to a concept that was discussed several weeks ago. And I think we'll change from this horizontal interdiction, this ground fire, everybody doing these dramatic things, to a more surgical approach, a vertical interdiction within the next month. And we'll have lessons learned along the way. You will. Protecting nursing homes, meatpacking plants, congregated residential settings, any congregated setting will be a tough job. Roll up our sleeves and figure that out.
So to that end, I know you'd mentioned industry testing. There's industry in nursing homes that are testing
Right.
en masse. Are those done through our Department of Health?
No, they're not. So that is an employer, as I understand this one nursing home that is outside our county jurisdiction, that was a corporate decision for them. And the best, as I know the topic, it was not springing from a surge of clinical cases. There may have been one or two, I don't know. But their corporate decision was to test everybody. And I get that. I mean, we've all heard these horrific news reports from nursing homes. But now what to do with these positives that have no symptoms? What to do with the healthcare workers that are positive, or the kitchen aide, or the high school kids with a job found to have the presence of the RNA in their nose? What do you tell their family, the wage earners back home? What do you tell them to do? That's tough. You're going to lock them all down for 14 days? If you play by the playbook, you call those asymptomatic positive cases a true case until we get further definition of this, and that's what we would direct them as a health department in our case contact investigation, 14 days, there are things that mitigate that 14-day thing. And you isolate the patient the worker that had a positive nasal sample but no symptoms. You do isolate them now, thinking they're a true case, for an X number of days. So those are things we'll still do case contact investigation of those from our health department as our manpower allows us to. So what I think about every employer demanding screening testing for their employees would be another maybe private sidebar. I'm not sure I'm sold that that's the best strategy. I think there's potential to really distract us here, and that perhaps we don't perfectly know the clinical significance of finding that RNA in the front of the nose in someone who's had no symptoms. How pathogenic is that RNA? I don't know. Nobody really knows.
So testing is just kind of a snapshot of what's
So-
occurring right now.
So testing is absolutely important. It needs to be important moving forward, but it shouldn't become the straw man to keep us from doing anything differently in a community as far as mitigation practices, and to be able to feel comfortable with downscaling that. You need to be smart and incisive with your testing. There needs to be a background of increasing academic/public health population-based testing, both RNA and antibody testing. And that unfortunately doesn't happen overnight. It takes time. There's a volume issue that helps you understand those numbers. Again, trying to get at that question mark regarding the prevalence, the denominator of this virus in any community.
So yesterday, the governor announced, I think, a federally funded testing program where he's going to open up, I believe it's 50 sites across the state over time with the anticipation. And I think it was 100,000 tests a month was the goal. Obviously, there's 92 counties in Indiana, and there's only 50 sites being proposed. Do you have any insight as to how those sites were chosen?
I do not know. I missed that briefing yesterday. The email I had on Monday was regarding the public health surveillance testing that will unfold over months, and I thought the number was 20,000 total tests over months. So this other mass testing that you mentioned, unfortunately, I'm not well informed regarding it, how
Yeah,
they
that
chose those
was
sites.
just yesterday that came out.
Yeah, and I assume those would be still primarily for symptomatic people, but I don't know
Right.
perfectly.
I think the way and it wasn't Dr. Box, it was her associate, talked that you could arrange a test by phone. You'd be triaged
Okay.
either online or by phone, and then given an appointment for a test. So I guess the question becomes, not having that capability in our county, and again, our county being relatively low, not as low as DuBois County as we heard, but still relatively low. Do you feel like the testing that we have could be improved? Now, I'll let you talk about the testing to handle where we're at right
So
now.
there is increased access to testing in this county through both hospital systems, well, 3 hospital systems that serve this county primarily, as their labs have increased their commercial lab sources have increased opportunity, and as the state directive has been to open up testing really to any symptomatic patient where the clinician feels a test would be helpful to them. So it wasn't but a week or 2 ago, we were still thinking in terms of a triaged approach to the testing based on how high risk the population, or how high risk the case was and how sick they were within a hospital setting. So increasingly, mildly ill outpatients can get to a test. It still takes, in most venues, a physician order to get to that test. And so I know, just as a primary care physician in this community, I would feel very comfortable obtaining a test on any of my patients with symptoms that I would desire a test. I would simply send them to one of the venues of their choice with an order, and they would get the test. Someone would come meet them, probably at a car, with full protective equipment, which is still an issue. You know, of course, you're consuming personal protective equipment as you do this. They would be offered a traditional nasal pharyngeal swab, and it would be sent either to a public lab or a commercial lab. Turnaround being 2 to 3 days. The 15-minute turnaround tests, in an email I saw just a couple days ago, still is not vetted, and the comfort level is not there, at least from the State Department of Health. Everybody would love that if it worked and meant something.
Is that the antibody test, or is that?
That was a nasal, or some type of respiratory sample. So a 15-minute turnaround with a quick respiratory sample test, or a 15-minute turnaround on an antibody test would not be trusted.
So it appears that the testing availability and access continues to improve. And again, the state was funded by the government, so from my understanding, if you have insurance, they would bill the insurance, but they will not turn you away if you don't have insurance. So again, access to Hoosiers seems to be improving.
Sure. And that's good.
Yeah, absolutely. All right, thanks. Didn't mean to put you on the
No,
spot.
that's okay. These are asymptomatic testing. I felt was going to be the topic of the week for me.
Right.
And I've had several conversations this week already, and it's a bit of an unclear thing for me. I'm not sure how to place it.
Sure.
I understand the employers really wanting it, and I get that. I personally don't fully embrace it at this point.
So I want to move to Commissioner Groninger. You've been very patient here the last 45 minutes and talked to us a little bit about the county and your approach as we sit here today, awaiting the governor's talk on Friday.
Sure. Well, I mean, not a whole lot's changed as far as our outlook. I mean, we did meet yesterday as commissioners, you know, and pretty much pending what the governor has to say here next day or so is probably going to tell a lot on what we're going to do as a county. But our plan is still at this point, if the governor does not extend the order, you know, we're planning on probably reopening the county on Monday. But there again, we'll be back to what we talked about all along. That first week would still be appointment only, like we're currently doing with the limited staff now, but bringing the full staff back, and then by appointment only that first week, and then rolling into more of a, you know, open to the public with restrictions. I mean, it's not going to be back fully open like it had been prior to this. There'll be additional safety measures in place with tables in the hallways, so, you know, people can't go into the offices, as well as the personal protection equipment that we need to have in place. But, you know, that's all depending on what the governor has to say. Obviously, we're sticking with his lead on what needs to happen there, but as well as our health department people. So as we work through those areas, I mean, our highway department and some mayor's office, some of those items that are, you know, essential, it has to happen. I mean, as this has progressed, I mean, potholes keep happening and tiles keep breaking down. So I mean, but you know, all that type of work can be done, social distancing with, you know, just a single person in a truck or whatever, to try and keep our roads passable and available for those that do need to use those. So you know, we're anxious to hear what the governor has to say. You know, I think that our people at the county's done a great job of you know, getting by with a very limited staff and doing what needs to be done as people have the needs that need to be taken care of, with some of our, quite a bit of our offices being essential to be able to have people have access to those services. So we've been proud of the people and how they've worked through that, so it's been good. You know, and I just appreciate our whole community and how they've, you know, continued to embrace it. I know as we see those numbers, you know, I get an email every day from your epidemiologist, and you know, it's kind of like, is it up, is it down? I mean, but, you know, that you got to stop and think about, you know, just how many people are actually being tested, because, you know, when you're testing twice or 3 or 4 times the number of people, you know, the odds are you're going to find more positives. So, but I think as we look forward, that testing is going to be very important, but, you know, it all has to be looked upon on overall averages and how that works out. I know a lot of our businesses are anxious to get back open again and start to get back to a little more of a normal life, but it's, you know, it's going to take some time. You know, it's not going to be a flip the switch and we're all back on. So other than that, I mean, our you know, we're doing all right as a county. I'm anxious to hear what inning we're in this week.
And just to add one more thing, there's been a lot of adjustments made at the state level as far as procedures and practices for our clerk treasurer and for public meetings, and a lot of things under an emergency order have made it easier to remotely do these types of meetings and protect the public, have our council meetings remotely. We will be watching as the governor changes the status of those orders, and again, certainly keep up with all of that. But I think there's been some things that have made it much easier to continue the normal business of the city and the county, instead of having to have the public come into our building, and our buildings both remain closed to the public right now. So, but that will certainly be addressed again as we wait and see what the governor has to say. Press, questions? Yes.
3 for Dr. Remington. You said you think it would be okay for a partial opening, but you didn't attach a date. Can you clarify?
Yeah, I would defer that to the governor and his scientific force around him to make the best decision that way. I can see us incrementally opening things up during the month of May. You know, so, but his executive order finishes
Tomorrow.
so I'm sure it'll open up to some degree.
How soon, personally, how soon do you think it'd be okay for restaurants to reopen?
Yeah, back to Senator Braun's comment regarding the entrepreneurial or ingenuity factor. I think if you can let that go to play, I think good owners will help you answer that. You got to give them some liberty to do that, and we'll see what the governor says about that.
And finally, how many of the cases in this county were hospitalized or maybe still are hospitalized?
Yeah, I don't have that number with me today. I have had that in previous graphs. Out of our total cases, those 34 cases, how many hospitalized? And I'm sorry, I can't perfectly quote it. I'm thinking it's between 15 and 20% of those.
Dr. Remington, going off the survey, just off
Yeah.
of the last week that you guys have had that out, how's the response been for that?
Oh, it's
Has that changed how you guys were approaching anything as far as things moving forward?
I think it does help us frame our daily briefing to our constituency, just knowing the types of questions and comments that people have out there. We've loved the great response we've had to that. A lot of people think they possibly had the infection. I don't know, but that's interesting. And there's a frustration regarding, at least historically, access to a test. I'm not sure that's as hot now as it was maybe in the rearview mirror, but those two themes came out as I understand that survey.
What inning is it? Are there going to be extra innings?
You know, I'm beginning to not like that nine-inning ballgame
have
scenario.
We're holding you to it.
So I'm going back to that fit-the-curve model that that I had received several weeks ago for our county. It was a 12-week, simple rolling hill. If we take that, we are in the midsection of that, with probably the peak week being last week and this week. So I would say we're inning 6. I think I said 5 last week. So let's say 6, a middle inning. And who knows if there'll be a late surge or not. But I don't want to suggest that our case count is going to plummet. I think we're going to see more new cases, but it's because of what we've been discussing,
tests.
just more tests, absolutely. And, but maybe if we look to hospitalizations, look to critically ill new cases, we'll appreciate that we are on the downhill part of this curve, which I really think we are. I think there'll be a lot more herd immunity out there than what we realize. That's my hunt. That's just my personal bias. Just seeing previous respiratory outbreaks. That happens. Whether you do social things or public health things or not, herd immunity eventually comes, and that's what makes pandemics a bell-shaped curve. The biology comes to play. So.
For those who don't understand herd immunity, could you explain that?
So that's when there's a background of some semblance of antibody protection in a population. Maybe that's not thorough enough to prevent every new infection, but if you get an infection, it's milder. There isn't the frequency of new cases that there would have been without it. The severity of the new cases is much lighter than if there had been no background immunity. That's why these novel strains are so rough on a population, whether it be H1N1 in 2009, West Nile virus years before that, or this novel coronavirus. It's made the leap from a non-human source to us, and it wigs us out. And there's no background population-based herd immunity to soften the blow. It's really in the raw, but eventually it subsides. The background immunity comes up. It's never perfect, but it softens the experience over time.
So resistance to the virus is kind of taken care of with asymptomatic spread that creates antibodies and,
Yes,
yeah.
yes. A mitigated host experience from the same virus. It's different. Again, there still will be bad cases. Every year with influenza, there are bad cases. So it's not perfect, but it's not the horrific experience we've had of the last 2-3 months.
So kind of as you suggested, and I think Senator Braun talked a little bit, you know, we don't have the data to understand maybe what percentage of the cases require hospitalization. Obviously, the comorbidities are going to play into that. But in a general population, you know, how many are asymptomatic, never show symptoms, pass through, create antibodies?
That's correct.
And they're done. And that's what we don't know.
Yeah.
And that makes it tough on the data. I think that's what the governor's Fairbanks study is trying to look below the surface and get that idea.
A prevalence study. That's what we desperately need. They just unfortunately take time.
Okay, great. Thanks. It's always good to have science backing decision-making, especially in this case. And I guess it really hit me today that as new as this is, we don't have a solid amount of data as far as foundational knowledge of the virus to be able to make informed decisions because it's still evolving. So that's been the challenge, I think. So, questions? Don, you had a question?
Yeah, I was just going to point out that with Kosciuszko County's sort of unique economic situation, you have between the biomedical industry and then also with the agricultural industry. Our agriculture does have several processing plants in this community, as well as just outside a few outside the border of the county. shown to be prone to severe outbreaks, to help them isolate positive tests.
So I'll turn that to Dr. Remington. I think that we kind of talked a little bit about that, and that is a concern.
So asymptomatic testing, I think you open a can of worms. It has its application, no doubt. I think you most strongly spring into that when you have found a focal display of the problem. That is, a particular plant now has a couple cases, or a particular nursing home has a couple cases. All right, you really lay a ground fire. We know now these are really high-risk settings. They're congregated, hard to get the separation. So lay a strong ground fire with testing. Asymptomatic people, people with symptoms, even the slightest symptom, absolutely. And then do the traditional public health measures, the case contact, investigation, and control, trying to pull out even the asymptomatic people from that high-risk setting. If you have not demonstrated that, then I think you get into murky waters as to what the significance of, again, a test of unclear bearing in that setting when there's no demonstrated disease. What does that mean to have some workers with RNA sitting in the front of their nose? The front of our nose, by the way, carries lots of stuff. So if you clearly see the footprint of evil, go after it. But if you haven't seen that, maybe that information doesn't overly help you, and now you're taking a lot more people out of work. And what do you do with their contacts at home? If you do it by the book, you quarantine them. They have no symptoms too, but you quarantine them. So there's a cascade of people now not working. It not only creates an issue for the manufacturing issue at hand, trying to get the job done, but as far as the economy of families, it can be devastating further. So be careful, I think, is my conservative voice with springing into lots of asymptomatic testing. As part of an academic study, as I mentioned earlier, a surveillance thing like what they're doing now, great. I know that doesn't immediately answer something in the back of the mind for an owner of a large agricultural facility. I get that.
I'm just aware of at least one that transports a lot of workers from the Fort Wayne area into our county
Yeah,
on a regular basis.
Yeah.
And there may be more than
yeah.
so that's-
I think we're at 11:30, and that's where we cut off. And I will, again, thank everyone. Next Wednesday, we'll have a representative from Parkview Hospital here to talk about their experiences, as well as our current lineup of Commissioner and Public Health Officer and myself. So see you a week from today. And again, thank you very much. Don't forget, if you need masks, they can be picked up at the fire station on Center Street. All right, thank you.
Thanks, Joe. Yep. Thanks for not kicking me out.